Alors, I was very naive when I was first a physiotherapist, and nobody knows what was osteopathy. And osteopathy was not a name very known, absolutely not known in France. So one of my colleagues said, when somebody has a small scoliosis, it's like a joke. You push in the center of the scoliosis, you have a noise, and you have no more scoliosis. So I said, I must do this stuff. I must do this stuff. Certainly, it's a kind of miracle. So you can see that my knowledge was very poor about osteopathy. But what was interesting, one time I treat a patient for a dorsal pain. And 2 weeks or 3 weeks after, he came to see me saying, okay, I feel better. So I was very proud. I said, okay, it's because of me. He said, no, it's not because of you. Because I saw somebody in a village, a bone setter, he fixed something on my stomach, and my dorsal pain disappeared. I was a little vexed, of course, because it was not because of me, but he gave me some idea, and at this time I did a lot of dissection. I work in a hospital in Grenoble with Professor Arnaud, who was a very good guy specialized in dissection. And since this time, I try to make the connection between the organ and the spine and the joint. And at the beginning, I never know, and nobody told me what was visceral manipulation. I tried to ask colleagues, it was not known, and even colleagues, they were laughing, saying it's a very curious thing that you are doing. So I tried to do something on the stomach, to move a little the stomach. It was with empirism, okay, not something logical. But some people felt better after. And little by little, I organized a little my feeling. And one of my colleagues, he worked in my office, Pierre Mercier, and he was logical, good in mathematics. And together we tried to organize some direction of the organ, depending on the diaphragm movement, depending on all the mobility of the body. And my results were better. I tried, it was in 72, 71, so it's a long time ago. I tried to give some courses about visceral. The first courses were not very sophisticated, rather simple, but organized things, and now it's a little more complete, and I like very much, of course. It was not known at this time, and I can say that my colleagues were against the fact to manipulate the organ, saying, what are you doing? What is this stuff you are doing? It was in France in 72, there were not osteopathic school. Only to do osteopathy was America and England. England, it did not exist. In America, it did not exist visceral manipulation. So I don't say that I'm the creator or something, okay? Because, under the sun, everybody has done certainly the same thing, maybe in the old time. What I did is to organize, to do the good axes, to put your fingers very precisely in certain part, and not to do something vague that some people maybe did. So I was a developer, certainly. So I'm proud to be the developer of visceral manipulation, and I was the first one to do it. No, what I said, when you start something, you have the feeling that you know many things, okay? It's why the young doctors, the young dentists, the young osteopaths are rather arrogant. They have the feeling that they can save the world. So maybe at the beginning, as osteopathy was not known in France, I was not an egomaniac myself, but I felt good. And little by little, I discovered that my knowledge was very poor, absolutely nothing. And of course, when you used to do anatomy dissection, what I did myself, you become a little more simple, okay? And you try to be more modest. And modesty also is because of the patient. Because you can say to the patient, I have the best of the world. I got an article on Time magazine, but the patient say, yes, doc, but I have still my pen. Even if you feel that you have the best of the world, I have still my pen. It's why when you treat people, in reality, you become very, very cool. I started to work with Dr. John Apledger in 85 because he organized some courses and I worked with him during years and years. We used to spend some holidays together to work because I love to see his hand. He has marvelous hands. So it's not something very new because 85 is 28 years now. And one time we separate with the Plagiar Institute and my colleague asked me to organize the Barral Institute. It was 7 years ago now. And it was very easy because since 85 I've taught a lot of people. So we have the good staff and it was not something so quick. The name, it's not me who decided to take the name of Barral Institute. No? It's my colleague. Because myself, I did not feel so good to have my name like it. But my colleagues say you are a little more known than us, so we must call it the Barral Institute. The first time I met Jean-Pierre Barral was 77 in Paris. I remember also with John, we used some unwinding, but now we stopped to use it because depending what you call unwinding. Unwinding is to turn a little around the fixation, and you always turn around the fixation. So it's why we have changed a little. For myself, I've changed to be a little more direct, a little more. It seems that it works better. And I remember when I worked with a disabled kid, with John, for instance, we were doing something turning around the fixation turning, but we needed a lot of session to get some results. And I remember that at the end, John and also Viola Freiman, they are much more direct now on the fixation. You know, the problem is we are manual therapists, and it was curious. In a certain time in France, some people were like ashamed to be manual. And for me, I'm very proud to be a manual therapist. So I never wanted to be a doctor to give some drug because maybe it was not my way. And manual therapist means that your hand will feel what is wrong in the body. And after you try to interpret with your mind what your hand has felt. And the problem now is to defend the manual therapy against some people who little by little push osteopathy to be more medical. And that is important. In France, I was one of the pioneers to defend manual therapy. And when somebody comes to see you, he doesn't remember what happened in his life. The tissues remember what happened in his life. So you know you say to somebody, maybe one time you fall down on the coccyx. You say, no, I did not. And 1 month after, he comes back to see you, he says, yes, doc, I fell down on my coccyx, you're right. Because you don't mind what the patient is saying. The body told you, yes, there is a tension on the coccyx, tension on this part of the body. So you have so many things that we don't know, so many things that the patient doesn't know, that it's preferable for me to believe in the hand and after to try to analyze what the hand was feeling. And I would like just to add something. I was doing 10 years a teacher at the Faculty of Medicine of Paris North. And we got some promotion of 120 doctors each time. They were so respectful about the hand, okay? And they have good knowledge. They were doctors, specialized, very often, very respectful about the hand. So it's why we are right to be proud to have a good hand. Without intuition, you cannot be a manual therapist. Okay, you must feel. And there's always something, the hand, when somebody comes, you feel something. You feel something, there's a connection, a not verbal connection, but a kind of physical connection. We have some electromagnetic field. I did a lot of research in Grenoble with some lab in Grenoble. And it's true that there is, each time you have a live tissue, you have the electromagnetic field around. So we must be a little aware of this electromagnetic field, and it's a kind of intuition. What is intuition? Difficult to define. But what is around a person, you must feel it. No, you have several parts. Of course, you have what you feel, but sometimes it's not enough. You feel that you have done, some session, you feel that you are good somewhere. Some other session, you feel that you are rather or neutral or, not so good. So you feel what I like, and when you feel a tension on the tissue, a real one. So you are sure, because you have a tension, that maybe you can release it. When there is no particular tension on the body, it's more difficult to get some results. So a good result is when the body tells me, yes, you have done something on me. It's not what the patient is saying. I fail about 20% of my patients. When I say I fail, I don't exaggerate the tension, but not the result I would like to have. And sometimes one of the biggest frustration is when you feel something and you are not able to release. That is a frustration. But myself, I was very lucky. When I was at the hospital in Grenoble, and a lot of people got some problem with tuberculosis and some other problem of the lung and the bronchi. I felt sometimes with my hand, I felt something in the thorax. And the poor people, they died because of tuberculosis. And after I opened these people to know what I have felt with my hand when they were alive. And most of the time there was a density, the abnormal density of tissues. So I know that the hand is good. I know that the hand is good, but there is always a limit of the knowledge. There is a limit of the efficiency. And I would say at the beginning of my career, maybe I got 30% of good results. Now I'm between 30, 80% of good results, but I still fail. And I never remember when I was successful. I just remember when I fell. So just something to add, you never heal somebody, you try to improve. You try to make a better compensation adaptation to the problem, but you never heal. Life is life. Huh? So, myself, I start from the hand. You feel a tension. Okay, you try to release the tension. And after, I come to anatomy. And I try to know what was. And so I try always to start from the hand. But when you teach also, you learn a lot. Teaching is learning. And it's, you organize a little what you feel. And sometimes what you feel is not enough to teach. So when you try to organize, and thanks to my students, I'm a little better now. Not so much, but for the knee, it works very well. When you have something swollen, we put some clay or some argile, that it works very well. Myself, I'm not very good in giving some diet, some other stuff. I try as I am giving courses about the hand, I try to focus the maximum I can on the hand, because if you do at the same time some acupuncture, some herb therapy, herbal therapy, some other thing, it's like you don't go to the extreme part of the feeling of your hand. So I use it sometimes because, this comes from a bone setter. The bone setter, I'm very respectful about the bone setter. My grandma was a bone setter. She was Italian, and a bone setter, very good. So I'm very respectful because these people were certainly before the osteopath, and we must respect their knowledge. But about this guy, he was a soccer player. So during maybe 8, 10 months, he was treated by cortisone, by anti-inflammatory drugs, and did not work. And it was interesting because he was a guy very expensive, of course. All the big players are expensive, and all the medical staff was around me. And when I say you must put some cabbage, they were like laughing. It was something so surprising for them. And happily, the mother of this player believed in that kind of treatment, and he did it successfully. 2 months after, it was perfect. Respect the tissues. In a life, you have always a frustration somewhere, of course, always a frustration. Maybe one of my frustration is music. I would have liked to be, I'm a very bad guitar player, because what I say each time I play, people ask me to stop. So you cannot be good in everything. But you know, everybody would like to have several lives. And life is always too short. But I was so gifted. I received a gift myself, and to do what I was able to do. I was gifted to do osteopathy at the very beginning. So it's easier to discover something at the beginning of a technique than at the end. And some of my colleagues, they complain. They say, you are writing too many books. What can we do? Us? What can we do? Okay. So I would like to have several lives, but like everybody. It's a book about the spine and with Alain Croibier, the spine and the pelvis. And you know, I have something also. I started a thriller a long time ago, and also for one of my friends is a movie realtor. And on this thriller, I would like to finish this book, but I'm not sure to have the competence to write that kind of book. My ideas are very good because they told me, but to write is something different. So maybe one time I will write this thriller. At the beginning, I like a bicycle because it's stupid. You must, when you have your brain a little too full, you have a mountain, you must go at the top of the mountain and after go down. Okay, that is, but I like it. Now we live in Camargue. Camargue is very flat, so biking is a little desesperating. So we will have 2 horses, and it's one of my challenge to do some horseback riding. And in Camargue, we have wild horses, very nice, so that is one of my challenges now.